Anal fissures or hemorrhoid fissures often can be felt like a sharp pain after bowel movements, and they usually last from a few minutes to several hours. If not taken care of, the pain can be extremely bad, up to a point where it can be hard to sit or walk. Other symptoms of fissures can be bright red blood in the toilet or on the toilet paper and a skin tag near the anal fissure or a small lump. Anal fissure is a term to describe the condition of the small tear in the lining of the anus. In other words, it's like you have a wound in your anus. There are several causes of anal fissure, but the most common one happens when someone passes the hard or large stools. Anal fissure also occur if you strain when go to the toilet or push too hard when passing stool. When anal fissure takes place, it can be painful. If the hard stools passed through the anus are big, this can risk bleeding. The hard stools can scratch the lining of the anus because of its hardship. In some severe cases, the anal fissure sufferers reported that there was bleeding during the bowel movements. An anal fissure is usually treatable by using home treatment. The healing process can take a week to 6 weeks, depending on the levels of severity. What are the symptoms of an anal fissure? The typical symptoms of an anal fissure are the pain and bleeding when there is a bowel movement. Some sufferers also experience the spasms in the ring of the muscle at the end of their anus. An anal fissure is usually common, happening in young babies. But adults can also be affected with this condition for some reason. Besides the pain during the bowel movements, it can also last up to several hours after the bowel movements. Therefore, the sufferers will feel the pain for several hours. To some extent, the red blood is spotted on the stool after the bowel movement. There is also small lump skin near the anal fissure location. If you notice the most severe symptoms like bleeding, you will need to reach your doctor as soon as possible before everything goes worse. It is recommended to prevent anal fissure from happening rather than healing it, because it won't be convenient for the sufferers to bear the pain and bleeding on a daily basis. Take the measures by preventing constipation or diarrhea. Eat fiber foods, drink a lot of fluids, and stay active. We'll explain it later in the next point. What causes an anal fissure? Anal fissure happens because of the passing large and/or hard stools. Anal fissure could also happen when the lines of anal work harder than it's supposed to be. This situation is familiar with chronic constipation or frequent diarrhea. The stools pass too often through the anal part so that it can tear the delicate skin around the anus. The other causes, which are not too frequent, are childbirth, straining, inflammatory bowel diseases, tight anal muscles, and so on. In rarer cases, the anal fissure could happen because of other conditions such as HIV, herpes, syphilis, anal cancer, and TBC. What is the treatment of anal fissures? If you are going to your doctor, here's what you'd expect. The doctor will examine the area around the anus. The result will come up immediately. Medication and treatment. Usually, your doctor will prescribe the nitroglycerin ointment for you to alleviate the condition by boosting the bloodstream in the affected area. It will help to calm down the inflammation in the area too. If your anal fissure condition is mild to mid-severe, the prescribed ointments combined with the diet changes and exercise will quickly heal you. Here are the things which can make you easier for your stools to pass. The foods to ease your constipation when it is hard to make the stools pass. That means that you need to change your diet. There must be something wrong with the way you eat so that your bowels do not do a lot of favor for you. The great suggestion is to focus your diet on fiber-filled foods like raspberries, prunes, and other fiber items that you can find in the usual market. For women, it is recommended to take at least 20 gr of fiber each day. For men, you could take at least 30 gr of fiber on a daily basis. The study showed that eating prunes routinely can improve stool frequency at a good rate. Also, over-the-counter stool softener helps making the poop softer for you to pass. Warm sitz baths a few times per day, about 15 minutes a time, especially after going to the toilet, will soothe and help relax the anal muscle. This will help the healing process. Surgical treatment. Almost anyone needs to take such drastic procedure as surgical help to heal fissures. It's very rare, but if you have a chronic fissure, it may be the best way to go. The aim with the surgery is to help the anal muscle to relax, which again reduces spasms and pain. Your colon surgeon will find the best treatment for you by discussing it with you and also going over the risks with the surgery. Usually these types of surgery are done the same day, as same-day outpatient procedures. If you cannot find fresh items from the market, you could also get the commercial fiber products over the counter. These are usually coming in the form of supplements so that it is easy to take it regularly. Besides the prunes, you could also consider other items such as kiwi, apples, pears, spinach, artichoke, leafy greens, kale, beans, chia, whole grains, and others. Don't worry, though. There are many items which consist of high fiber. So, you will eventually find the right items to help you to overcome the problem. Drinks which makes you poop. When it comes to the beverage, there is no such thing as a magic solution than pure water. Your body needs to get hydrated well so that the stools will easily pass. Imagine that the stools are too dry. It will be hard to come out. The more water you drink, the easier the stools will slide down and out. It is because the water is absorbed by the stools and makes them softer so that they can easily pass. Stay hydrated by drinking at least 8 glasses of water on a daily basis. The supplements to help you might not feel that the diet changes can be as easy as you thought before. When you suspect that you are having a problem with it, then you might feel that the problem will not go away in just a day or two. You will need something to effectively kickstart the process and help you to attain the best result. Here is where the supplements enter to help. There are many fiber supplements that can help you to improve the bowel movement. But before proceeding to get one for you, you will want to talk with your doctor to ask for suggestions and advice. Consult with your doctor to find out which one is the best for you. Keep in mind that getting the supplements could risk experiencing the side effects if you are taking high doses. It can cause diarrhea. In the over-the-counter products, you will find the psyllium husk as the main ingredients of the supplement along with the other ingredients such as probiotic, fenugreek, vitamin C, and so on. Conclusion. Fissures often easily comes back. A fully healed fissure can come back if you pass hard stool. Many other problems can cause symptoms similar to anal fissure, like inflammatory bowel disease, infections or anal tumors can behave the same. If your fissures doesn't improve with the treatment you are doing, it's important to seek counseling for other possible causes.